Mm.
This time. Yes, Sarah.
Gotcha. Okay. Evening. As we wait, when I join, we can start by introducing ourselves. Naona around to 23. So we can start by introducing ourselves. I will request Marquins to pray for us before we start.
Okay, thank you, Sana Chairman. Let's believe and pray. Our Heavenly Father, we come this night into your able hand, God. As we want to start this meeting, kindly take over, kindly take us through. Whatever is going to be said here, let it be of great importance to us. I only ask those believing and trusting. Amen.
Amen. Okay, my name is Evans Socheng, popularly known as Young Babu. Privileged to serve as head of public service KUSO. KUSO is Kenya University Student Organization. I'm the chairman of this committee that was created by our director, Byron. I think he's in. Yeah, naona ashaingia. Cyrus Jirongo, you answer. Connect to G. Sawa. Okay, poleni kidogo, my network ilikuwa na itch. I saw Cyrus Jirongo alibeba mkono. I don't know kama alikuwa na kitu ya kusema. Byron, you have something to say, Bwana Director?
Oh, I think you can just continue, please. I have a network problem, but I will be back.
I don't know if the number is okay or we wait for a quorum because I see a number still. What's your thoughts, Mark Wings?
Bwana Chairman, we can give them time because we need the audience. So let's give them time. They join kidogo kidogo.
Okay. To any minutes because a number like I'm seeing the PS ako ndani na PS is engaged to mingi, so hatufai kukaa sana minus kuanzisha mkutano. Byron, what's your suggestion? Naona only 24 ndo isha.
I think let's give them around 5 minutes if possible. So let me go back to the group and alert them, please. So you can continue. So let me go back to the group and alert them.
Oh, okay. Byron anaambia wengine wa join, tunaanza na introduction. I can start by introducing team members. Please, can you mute your microphone? I can start by introducing my... Willis, mute your microphone. Introduce my committee members, starting by my Deputy Mike Wings, Hilary, Hope, wamejoin wote. I will give them a chance to say one or tukisubiri wengine waingie. Yes, Mark Wings.
Thank you sana bwana.
Hello, Honorable Madam PS Mary Muthoni, Honorable Seniors, leaders present, distinguished officials, and my fellow comrades from various universities. Good evening. I'm Hasimo Hilary, and it is with great humility and great honor as the coordinator for PS Mary Muthoni University Charter to represent university students across the nation. PS, we are truly grateful to engage with you directly, and we believe in constructive dialogue and partnership to address issues like drug and substance abuse, prevention among youth, and access to affordable healthcare for students in our universities. Comrades, this is just a start. Once again, thank you, Madam PS, thank you, comrades, for accepting this invitation. We are very ready to listen, to learn, and to collaborate. God bless you, Madam PS. God bless our universities. God bless Kenya. Asanteni sana. Back to you, Byron. Chairman, you can take over.
Okay, asante sana Hilary. Dennis ako ndani?
Yes, niko nani?
Okay, you can. Hello, Dennis.
Hello.
Yes, ni wewe ndio tunapiga ongea.
I'm in.
Yes, you can introduce yourself kindly.
It's okay.
Hello, Bwana Chairman. I think you can take control because I don't think kama ako na active nini bundles.
Hello. Can I introduce myself now? Chairman.
Yes, you can talk, bro, talk.
Okay. In a minute, please, Kadri. Am I audible?
Yes, bro, talk, bro.
It's okay. Once again.
Bwana Chairman, can you take over control? The King's is not there to be found. As we wait for Chairman, I don't know what is wrong with the network of Chairman. We can just continue.
Boss, even me too. My network, I don't know what's the problem, please.
So, Director, once PS is set, you can just tell us so that we can move on.
Yeah, PS is very set, please, and I think Chairman can continue. If the introduction is done, then we can move forward. So, Marquins, can you check?
Okay, thanks, Sana Bwana Director. I think everyone has introduced themselves. Now, if we move with the speed, I just want to introduce our super PS, Madam Mary Muthoni, to take over the program. Everyone, kindly, when you're joining this meeting, kindly mute, and unless upatiwe naomba tu afadhali kwa unyenyekevu, ukiingia kindly mute, ndo tukuwa na one program. Ukiingia kindly tafadhali mute your mic.
Okay, thanks. I'm back. My network but haitasumbua tena. Introduce. So it's time we introduce yes. Super PS, extended our invitation to our colleagues that serves from different institutions, student leaders and their vice. Meeting nimeona president wa multimedia ako in, vice president in, we also have the Secretary General of Mount Kenya. We have the Speaker, KU, a number of student leaders to Alice to say something. Alice, if you are here, you can unmute your microphone and say something.
So I don't know if you have the problem with the network. I don't know because sijui shida iko wapi. So Marie, please can you please weka mic yako off please. Marie, please. Funga kamera yako. I don't know, sijui shida ni network. I don't know, sijui shida iko wapi.
Yeah, kuna director. Director Byron.
Yes.
There is a network problem.
Yes, yeah, I think kuna shida na network. Juadi mimi na face sana.
Maana zina katika. Like mimi nimeenda kujiintroduce and the network was imefanya nini?
Yeah, even I can't see. So before let's give Nyakundi to introduce himself, please. Nyakundi. Chairman, if Nyakundi is not available, please invite PS.
Before PS come, I think Mbarira, you can close your video, please. Mbarira, you can close that thing.
Before I invite the PS, kindly before you speak, you are not given a chance to speak. Kindly mute your microphone because the phone is on. Ina disrupt watu wasikie watu nasema. Okay, within us, I've seen Daktari Ramesh, who was General UON. He can say a word or two before we invite. Yes. Karibu sana daktari. Yes, Ramesh.
So, Chairman, we are really facing mambo ya network. Wengine wanaongea wanapotea. So, I don't know.
Director. Byron.
Yes, I now hear you.
Ama it's the app de kona shida.
Yeah, because I can see some people are inboxing me that they are trying to join, but in a hang. So I don't know the problem. But I think we can just continue. The technical team are on it. So we can just continue, please. So, Mr. Chairman, I think you can just invite PS to carry on, please.
Okay, asante sana. I think committee members if karibu wote ninawasumbua. So allow me to introduce atuambie tusikie from her. PS karibu sana.
Hello, good people. Mko poa?
Yes, we are good.
Sasa
We are good, but network.
Poa sana.
Network imeenda wapi?
Kama majority wanatumia Airtel.
It seems like most people are not they are not online, eh? I mean, they are not the system cannot accept them to speak or something.
I guess most people are using Airtel, maybe somehow. That's why the system imekuwa difficult kwa kujoin.
Hiyo tutaendelea kuchunguza namna gani hivi na hivi, alafu tutengeneze. So guys,
Okay.
Thank you so much. Thank you so much for coming. I can see the president of Karatina University is here. I can see Elijah from Homa Bay County. Naona nani mwingine. Si tuandike tu hapo kwa chat. Mwende tu hapo kwa chat. Mtu aseme jina yake, aseme the campus you're in and maybe what you're doing in school, just for our knowledge purposes. Alafu nitawatambua mimi nikiendelea. So mi nimefurahia sana. I'm so happy to be here today. I'm happy that nakutana na comrades. There's one time I was a comrade also. Pale Kwea. Sasa ni jukumu langu saa hii kushikana na macomrades ndio tuone hii nchi tutaipeleka namna gani na mambo yetu tutaipeleka namna gani. Kwanza hii mwaka nataka kutembelea macomrades kwa kila campus yenu. I don't know whether that is a good thing or not. It's because we are proposing issues that we need to start debating upon. And my interest is basically information passing and to listen to you. Sometimes I also have opportunities kwa comrades wenye wameshamaliza shule, lakini kama siwajui wengi, unajua sasa hata kama kuna opportunities siwezi nikapata. So I'm looking forward to really working with you. Acha kwanza nitambue hawa macomrades wako hapa. Brian Malemba, KUBCom. Dennis Wamboi, Kings from Nyandarua. Hey. Alafu kuna Kasimwa Hillary Multimedia University na Kugotea pia. Kuna Doris, at least kuna mama, nimepata mmoja. Doris waambie mademu waingie bana. Doris Cherotich from Baringo County Technical University of Kenya, BSc Medical Laboratory. Lavan Odhiambo, President Maseno University. Lavan Yaje. Salute Maxwell George from Homa Bay. Jared Agunyo from Kitengela Anita. Tuko tayari. Caleb Nyakundi from Nyamira University. Peter Okello. Simon Watende, Karatina University.
Hello, Super PS. You have muted your mic. We are not hearing you.
It's a bit now, Dori. Tutapea wale
Can you hear me now?
Yes, we can.
Yes.
Yes.
Ay. Na venye nimeongea.
Network yetu
imezama hivyo. No, nilikuwa nagotea. Nilikuwa nimefikisha nani? Kuna Caleb, kuna Elijah. Elijah Otieno anasema tuanzie na Homa Bay. Sasa, maybe you can just give a shout out to the universities that are here and the colleges, because I've also seen KMTC. Brian, you can just check which universities are in, and then I can speak to you, if that is in order.
Okay, asante sana. Yes, I've seen the president of KEMU, that nimeona Safia ako ndani. Emeritus Secretary General ndani. President Karatina. I've also seen the president of Meru, the president of MKU, Secretary General of Moi University. I've also seen the treasurer of Masidemu. Wengine wanatumia jina sivyo. Okay, asante sana. The network is a bit favorable now. I can give Safi a microphone aseme kidogo tu tukiendelea. Yes, Madam President.
Yeah, it would be important to allow the presidents who are in to say something.
Sure.
And those who have been sent to represent. Like I can see the speaker of Mama Ngina University. Sophie? Has she heard? Amesikia?
Cool.
Maybe if
Sophia,
Sophie
are you there? President Kemi University. Kemi, are you there, Sophia?
Maybe Arnold, Ama, they are not able to speak. Can somebody mute their mics? I mean, unmute their mics.
Okay, unmute. Jim, want to speak, their mic is automatically in a mute.
Hello everyone.
Yes, karibu Rais.
Hello. Yes, this is Gerald, Karatina University President. I think you are hearing me, Madam PS.
Yes, I can hear you loud and clear.
We normally have a challenge with this thing, a big Bluetooth button. Most of them, maybe probably, have not used it earlier. And if possible, the technical team can be link.
Assisting.
Or Zoom. Because this one, when you are tuned in using the listen only, you cannot unmute. Yes?
Currently the only person in this conference.
So the meeting has elapsed. We've all left?
No, we haven't.
No, we are back.
How many other people who are here?
Okay.
Yeah. Irene, you want to say something?
No, I was wondering their silence, but I don't have anything to say.
I think it kicked out some people.
Okay.
Yeah. We were at above 120. Now we are below 50. But they're joining in.
Yeah. So can we give them a minute?
Yes.
We give them like 2 minutes to join in, eh?
Yeah, that's okay.
Okay. We have lost all the introduction. There is also YouTube Live.
Hello. Am I audible? Is everyone hearing me?
Yes, we can hear you.
We can hear you.
Yes.
Okay, I think there's a problem with this. I think next time we will plan accordingly and use maybe Zoom. This one, everyone are complaining about this one. I think the chairman next time and the director Byron will facilitate we use Zoom.
Majority of
Next time we shall deal with Zoom.
problems. The number is rising steadily. You can go on.
We had said we give them just a minute to join.
Okay.
But once we join, we need to know who is going to speak.
Ramesh will be speaking. Also will say something. Then President Karatina will continue.
Okay. What namuona
Super PS, you can unmute. You can unmute. You have muted your mic.
I think I'm just touching. Can you hear me now?
Yeah.
Yes.
Yes. So I was saying I can see.
We can do. We should not only join as listeners, but to join your audio. On here.
I can see Busia County, Meru University student, Collins. So karibuni sana. We can go on now?
Yes, Papias.
Yes.
Yeah. So first and foremost, mi nimefurahia sana kuwa join. This is the first time I'm holding a meeting with university students, and mimi yangu ni kutoka kwa roho, because as I have told you once upon a time, I was also a comrade. Kwa hivyo nikiona ma comrades napendanga sana kusikiza zile story wako nazo, na pia kuona venye tunaweza tukasaidiana, because hii maisha ni kusaidiana. It is you can never be a one-man show in anything. Today I'm a PS. The privilege that I have, I'm supposed to share it with nyinyi, kwa sababu nyinyi ndio mtakuja mchukue hii position in future. Therefore, I'm happy to join you and I'm happy. Naona pia watu wanaingia wengi, lakini tutaendelea tu as they continue joining in. Why I felt it was important to talk to you. I know the tagline was "Say no to drugs," and amevutavuta vitu mingi hapa ndani. Atuambie tu inakuanga ama experience ni aje, and what is your feeling about moving on. Mi nakuta dawa zingine zimeandikwa only to be sold in Kenya. So the question that always goes through my mind is, kwani hii dawa mbona ingeuzwa mpaka kwenye imekuwa manufactured? Ama why would you want to buy something that is just to be sold in Kenya? That yenye unaletewa si kitu mzana. And ndio maana tumekuwa tukifuatilia hii maneno, so that hata kule kole we are able to educate each other. Sasa I don't know why somebody is telling me to leave the session. Ndio hata nyinyi wenyewe muendelee ku educate each other pale university, college, so that hata kama unaguswa sana kuvuta hiyo kitu, then unavuta ile yenye at least it is legal, ama it has been allowed to come to the country, and at the same time you don't overdo it. Mi nikikaa hapa sasa ningependa kusikia first experiences zenu, na pia niwaambie ya kwamba I would really want to come to your colleges and continue having this discussion, the health awareness issues, not just on drugs, kwa sababu iko maneno mingi sana. Firstly, this month alone is cervical cancer awareness month. Sijui kama madem kule kole wanajua that they need to go for cancer screening. Cancer can get anybody. It can get even, I don't know why somebody is stopping the nini from recording. Kindly don't change the, yeah. So this month, I was saying, is cervical cancer awareness month. So I would really want wale mademu wako kole, hata kama ni girlfriend yako, ama ni even mamako mwenye ako nyumbani, ma sisters wako, you just remind them that they need to go for screening, because cancer inaua watu wengi sana sana. And kama Kenya peke yake, mambo ya cervical cancer, about 6,000 people, ama 6,000 women wanaendanga hospitali. Wakienda hospitali wanakuwa diagnosed na cervical cancer. More than half.
Yes, unmute.
Are we okay now?
Yes.
Yes.
Yeah, good.
So unakuta cancer is a very serious preventable disease, lakini unakuta cervical cancer wamama kama 6,000 wanaendanga wanakuwa diagnosed every year. 6,000, can you imagine? Na half of that, ama more than half of that, wanakufanga kwa sababu wanafikanga hosi kama kama imeshakuwa kwa mwili, yani imekulemea, you're actually on the verge of dying. Yeah. So you see, you've gone to hospital, but it cannot be treated. Then again, unakuta cancer is preventable kama imepatikana mapema, and it's not just about cervical cancer, ni mpaka cancer zingine zote zinaweza kuwa preventable when it is detected early. Then unakuta maneno ya screening watu wamepuuza, hawataki kwenda hosi, mtu hataki kwenda kuangaliwa. Kama mtu haumwi, usikii kama unataka kwenda hosi. So then again, there are also other cancers that are caused by drugs. Hizi tu zenye tunavuta, unakuta zina cause cancer ya throat, cancer ya lungs, cancer ya mambo mingi. So it would be important kama sisi ni ma students. I'm not trying to tell you to be a saint. That is not what I'm preaching here. What I'm saying is tunafaa kuwa tunajiangalia, sababu hujui kesho itakuaje. Na me I'm older than you. Maybe I'm even double the age of some of you here. Sitakuwa PS forever. We uko Karatina leo, uko Jaramogi, uko KU, uko UN. Nyinyi ndio mtachukua hizi viti zetu za ma-PS. Hata wengine wenu watataka kuwa president, lakini utakuwa president aje kama umeshaoza. So it would be very important tuangalie hii maneno ya drugs and substance, tuangalie mambo ya magonjwa, and just to note figures, facts and figures. Tobacco related illnesses cause over 9,400 deaths annually. And this
Hello, again you have muted. You have muted.
Yeah.
Because
so you can imagine 9,400 people, we are losing them out of tobacco. And that is not how much we get even in taxes. So we are losing people out of a product which is brought in. Yes, there is a solution funding that is given or that is taxed, but at the end of the day, we are losing more people out of that. Again, adult smoking has declined. At least it has declined. Lakini wamama wameanza kuvuta electric cigars sana. Wameanza mambo ya velo, wameanza mambo ya pouches. So the use of nicotine on women has gone higher, whereas the country's adult smoking is declining, ya wamama ina increase. Ako wapi? Niliona nani? Atuambie kwa nini. Cynthia, utatuambia ni kwa nini. Then another thing which we need to note is 3 in 10 young people are exposed to tobacco. 3 out of 10 young people. And this talks about even the teenagers that we are having it.
You can mute.
Cynthia, si mute kidogo. Yendele.
Mute.
So
yes.
Then some smokeless products, if I may just say, some smokeless products have been found to be spiked with hard drugs. So unakuta ile nicotine product unasema ati hiyo ndio favorite. Some of them are spiked with hard drugs. Na ujui kwa sababu hawakuambii, ndio maana wanaandika this is only to be sold.
Hello, iko sawa.
My laptop seems to be very sophisticated. Inajizima tu. Yeah. So as a government, we are treating substance abuse as a public health threat. Hiyo ni threat kubwa sana katika nchi yetu, and especially to the young people. And that is why I feel I need to have a conversation with the young people. And it is not just drugs and substance that becomes our entry point. Mi nataka muni invite events zenu, mi nataka niwa invite events zangu, mi nataka to create events pamoja, ama to create issues of convergence pamoja, so that we can see how we can go on. And it's not just about drugs. Let's talk about jobs. Ukitoka kole, unaenda wapi? What skills do you have that you can benefit from? And where can you benefit these skills? Mi labda niko na information yenyewe mwenyewe hauna, and it would be important that I tell you. Sometimes I look at young people looking for jobs, and I have directed so many of them. Nawaambia kwanza, before you even tell somebody nisaidie, kwanza enda kwa website ya Public Service Commission, Google that website, cheki kama kuna majobs, then go to the National Employment Authority website, check if there are jobs there. And don't say ati serikali hakuna kazi. Kenya iko na kazi nyingi sana. Lakini many at times is when we don't find that information, which is going to help us to get to the next level. So this platform, mi ningependa ikuwe ni ya kusaidia comrades, kuwasaidia mambo ya how to help ourselves move forward, na kama tuko na shida, because saa zingine unakuta mtu amepatwa hata na mental health issues, and it's not just about it's not because you take drugs, lakini shida tu za ulimwengu zimekupata, na hiyo si kitu new, you know, ni kitu yenye sisi wote tumepitia. Hata mi at one point probably nimepitia kitu kama hiyo. So we would want to see how to help people to cope with issues around mental health, and also see how we can improve it at our college. Sitaki kuongea sana leo because this is our maiden meeting. But if you look at how many comrades are in the country, manze ni wengi sana. So next time tusikue watu 100, tuitane, tuambie watu, na mfungue WhatsApp groups za colleges zote. Let everybody get into the groups. When we call for a meeting, wacha tukuje. Tukiitana mkutano ya physical, wacha tu mobilize, wacha watu wakuje. And I'm not coming here with anything political. Mi nakuja hapa ndio tusaidiane. Because one, I'm older than yourselves. Secondly, I'm in a position that I can help as many comrades as possible. Nilikuwa nimeinvite PS wa youth. Mi nataka nimgote nisikie kama anaweza akaingia ama si ndio?
Yes, sana bosi.
Yes, anaweza join.
So so I want we give 1 or 2 presidents waseme kitu. Meanwhile, I reach out to my colleague PS wa youth. Si mnajua PS Fikirini?
Yes, hiyo ni comrade kabisa, ndio.
Yeah, wacha nimpigie nisikie kama bado wako na chance ya kuingia. At least awasalimie na awaambie venye anafanya kwa my youths. Si tukisaidia na hivyo, hata mnaweza msaidia na mawazo, how you want to be treated, how you want to be engaged. Na sisi tuko tayari. Sawa sawa? So 1 or 2 presidents, muingie, museme kitu, alafu nikuwe nimepigia PS. Ndia kuja.
Okay, asante sana. Let's start na Ramesh Saxena, incoming member of parliament Suba North. Karibu sana kiongozi.
Yes, asante sana Chairman Evans for the opportunity. Confirm kindly kama unaweza nisikia.
Yes, mheshimiwa nakusikia.
Nice. Thank you. First nataka nichukue hii fursa kutoa shukrani kwa Madam PS kuchukua time yake kupatana na comrades. Naona anasema say no to drugs, na hii meeting pia ameweka time fiti. Najua Friday saa 3 ndio time comrades wengi wanakuwa tempted. So hii meeting pia ni one way ya kusaidia hapa. Yeah, so my name is Ramesh Saxena. a fresh graduate from the University of Nairobi. Before nitoke shule nilikuwa na serve kama SG wa University of Nairobi for 1 year, then niliserve kama governor Faculty of Health Sciences, hiyo ni KNH, for 1 year. Na hii mambo ya drugs ina strike straight to vitu nimeona kama kiongozi na kama students, because data ya shule yetu ilikuwa ina point to the fact that faculty ya health sciences ndio ilikuwa na watu wengi zaidi walikuwa wanatumia drugs. Then after tumeingia kuserve the whole school, then sasa unapata ile shida ya matumizi ya madawa za kulevya inakuwa on a bigger scale. So for me leo nimekuja tu kusema this is timely because nimekaa shule kutoka 2018 na the last time niliona a heightened campaign against drugs or against substance abuse kwa the universities ilikuwa in 2021, na even then ilikuwa that successful because it was student led, because we had events ambazo the student leaders from the associations ndio walikuwa na spearhead. So for me, na ningependa kusema that one way ya kusaidia comrades ama one way ya kupunguza hii madhara ya madawa za kulevya among university students ni kitu the peers amesema already, ni atuite mikutano zake na tumuite kwa mikutano zetu. So chenye naweza sema ni from my experience, watu wanasikia sana from their peers. Like kama beshte yako amekuja kwako akakwambia mazee, mimi nilikuwa nimetumia cannabis lakini mambo iliharibika, you are more likely kumsikiza than mtu ajai experience matumizi ya madawa za kulevya akuje akuongeleshe. So if there is a way that ofisi yako Madam Pierce inaweza work na these student associations so that tukue na either institution specific ama region specific days za kuongelelea substance abuse, itakuwa fiti sana. Na hizi sessions zisikuwe tu that tunaleta watu wa nakada, tunaleta watu wa ministry waongee alafu watu waende, but now the student leaders in the associations wanasaidia kutafuta wale wanafunzi ambao wametumia drugs, wameathirika, wamereform na wako willing to tell their stories, wakuje wakae kwa hizi sessions waongeleshe their fellows, alafu watu wanakada wanaweza ingililia, then the ministry inaweza ingililia. Kwa sababu nilikuwa naangalia data ya nakada ya drug use kwa universities, Kenyan universities, inasema that watu wanatumia drugs sana, but one of the factors in our push, 68% ni friends. Peers ndio wanapush watu kwa drugs, then ina mean that tukitumia evidence specific solutions, then it mean that we'll have to use these same friends to lead our students away from drugs. So one thing yenye ministry inaweza fanya ni Madam PS vile ameanza ashikane na viongozi chairman Evans, mnaweza saidia mcoordinate, mko na contacts za student associations karibu Kenya yote. So mnaamua kama mtafanya hizi campaigns institution specific ama mnaamua mnaenda kufanya campaign ya Western, Nairobi, wapi na tukuwe na testimonials. Hata kama tuko na social media campaigns za TikTok, Facebook nini, ikuwe from a point that zinakuwa led by the youths themselves wenye wameathirika na wenye wanaweza tell their stories. the other thing yenye nilikuwa nataka kusema ni unapata that kwa hello.
Ramesh, let me check your mic.
Yeah, I'm back. I'm back. Can you hear me now?
Yes.
Yes, Dr.
Okay. Yes, I'm on to my last point. So nilikuwa nasema after the other thing, Madam PS, you could kindly do is, from my experience from the 2 years, niliona that student leaders ndio the first contact point ya students mambo ikiharibika. Napata mtu aki overdose ni wewe unaitwa, because in my last year of university tuli lose a classmate mwenye kesi yake pia ilikuwa tu overdose, na student leaders ndio walikuwa na yeye until the point of demise. So unapata mtu akichizi kwa campus yako ama faculty, unapata student leader ndio the first point of contact hata kabla security ama faculty waitwe. So kitu moja ningependa pia organize even before going to the universities ni kukuwe na a meeting, an urgent meeting where your ministry inaita representatives from the associations, mnawakalisha chini na watu wako from your ministry, people from NACADA, watu wenye wana work in the hospitals, wa psychologists ama watu wana deal na mental health issues, wakalishe our student leaders chini ama the representatives, wafunzwe on how to deal with these situations. Ama kuna student leaders wenye hawajui hii mambo, any drug related incident ikifanyika, how do you tackle it? Ukipata mambo inaharibikia one of your students, what do you do? Watu hawajui hata wakitaka contact kina NACADA wana contact aje. So if you can get resource people to talk ama to sensitize these student leaders on how to best deal with managing crisis, drug related crisis in the campuses, and again to sensitize them on the best way ya ku perform hizi campaigns, hizi say no to drug campaigns within the faculties or the campuses, then by the time campaigns zinaanza, you find that kila mtu ako on the same reading ground, kwa sababu itakuwa message yenye representative ndio wakisi yako nayo, na ni hivyo. So one, sensitize these students through a meeting, waitwe Nairobi, najua hii haiwezi shindikana, alafu pia ministry isupport institution specific ama region specific campaigns za kusay no to drugs na zikuwe pia led. Nimeshukuru sana. Ya mwisho, mimi nangoja kuwa posted kama intern, medical intern, yeah. So tunakuanga na vita hapo, but sasa naona mambo iko sawa, tunashukuru. Kama kuna space ya kuongelelea hiyo, utakubali tukutafute kando pia. Asanteni.
Okay, asante sana Ramesh.
Yeah, thank you so much. I think I can just respond to some of the issues. One, I truly appreciate the advice that you have given, that we need to bring on board the leaders and listen to them, which I will want us to do in the next 2 or 3 weeks. Because as the leaders, you need to understand the issues or how to respond to emergencies around drugs and substance. In a nutshell, that is what I have heard, right? Then again, you have also proposed going into the colleges, but before we do that, we meet the leadership. Is that what you have said in a nutshell?
Yes, that is so.
Yeah, because we need student-led campaigns. Then you start with the leadership, You don't start by going directly to the ones who are already using drugs. I hear you. The person taking notes can help us pin on that. Yes, I know you are waiting to be posted as an intern. I hope you have graduated and I hope you have passed your exam.
Mambo yangu iko sawa kabisa.
Kama yako iko sawa, Julai mimi nakupost mara moja.
Sawa sawa.
Ni kweli. You know, just mention that issue of internship. As a government, we work with we work with the calendar year. No, not calendar year, financial year. And our financial year starts in July. That is why most of the time we post in July. And we have said we will be posting once in a year so that we don't have problems of budget. There's no point of posting you and then I have a problem paying you or giving you your stipend while you already posted. So just be patient. Lakini hiyo maneno ya interns tumeichukulia kwa uzito and you will never have problems again.
Asante sana.
Aye.
Asante sana. The next speaker is
Hillary ni
Lucia.
fire, si fire.
The next speaker ni Vice President Egerton University, Lucia Mora.
Thank you. Good evening, everybody. Good evening, Madam P.
Good evening, Lucia.
Mora. I'm the Vice President of Egerton University, and I happen to be a medical student, very passionate about the youth and this topic in particular, because as we even speak, I'm actually rotating in the psychiatry department. And as a sister, a future mother and everything, it's so touching. And this is a message I would like to share with every Kenyan because, you know, we join campus and we are young, very ready to explore life. And then nimeona it's like the moment you start engaging in drugs, like you never know. You see, you can see other people enjoying and it works for them. And what
we've lost her.
Madam President, unmute kindly. Mute.
Hello?
Hello.
Yes, you are back.
Yes. I don't know why it keeps muting me. Okay. So family dynamics and genetics affect the way we can all, like the way drugs affect our bodies. And therefore, because it works for your friends, it doesn't mean it will work for you. Your friends can have fun, but you will take and then equate a one-way thing, like you just become mad. And then I've seen so many dreams lost, like very beautiful ladies and young, strong, brilliant men in the psychiatry department. Now, it takes a lot of resources and stress actually to get back to being normal and living a normal life. And therefore, I'd like to share this message to every Kenyan youth. And thank you so much, Madam PS, because you are taking a path that has been ignored for so long. Yes, it's been working differently, but I really appreciate you for the kind of approach you are using, because it's us, the youth, that can actually influence each other through the means that we understand to reduce this crisis. So I support everything that Ramesh has said. That's actually what I had to share, because we need to do sensitization and work with county security committees. Personally, I have been working with the county government of Nakuru and NACADA to try and share even those contacts. You know, sometimes, as Ramesh said, something happens and you don't really know what to do as a student leader, because not every student leader is a medical student, for instance. So sensitization of student leaders will go a long way in ensuring we know how to handle such emergency situations. And something I thought of is like we have a podcast where we have patients who have recovered, who are youth, who would actually like to share the experiences and the effects of drug abuse and how to stop getting into the trap. So by sharing those lived experiences, we will get to encourage more youth to stay sober. Like if you are yet to test alcohol, if you are yet to smoke, please do not start, because many were very okay in the past few years and life is totally different for them right now. So this is so emotional to me, especially now that I've seen these cases, and I'm so grateful, Madam PS, and I hope to be working with you and all the NGOs and everything possible to even brainstorm better ways of handling this situation. Thank you so much.
Thank you. Thank you, my dear. There's somebody who's really asking whether they can say something. Kevin Masharia. Is Kevin Masharia there? Meanwhile, you can follow me on my social media pages. I have put in the chat both IG, X, Facebook. I'm on all social media pages.
Asante sana Super PS. Our next speaker is Sophia. And
Thank you so much for the opportunity to speak. So my name is Safia Galmguyo. I'm the student president at Kenya Methodist University, main campus, which is located in Meru. And in this meeting, I can see we have a representation from majority of the counties. So this is, it shows it is an initiative that it's going to involve all student leaders, not just the ones from Nairobi. So Madam PS, thank you so much for coming up with this initiative. It's nice seeing officials in the government consulting us and putting our needs forward. So, and now as a student leader, I'm also a medical student. I'm in 5th year currently. And
nice.
The two previous speakers are also medical students. So they've given their perspective as a medical student and as a student leader. And we are now seeing a rise in cases of drug abuse and substances. It is something that is already there. We need to understand that. And now we have to ask ourselves, why is there an increase? Why are majority of university students using drugs as a coping mechanism? Majority of the time we say that ni mtu anakuwa kichwa ngumu, ama they're just rebelling. They are forming a rebellion. That is the stigma that is associated with drug use. But when we come to look at it, majority of the time now, as now I'm a student leader, I see that rebellion, majority of it ni a coping mechanism. From what? From the academic pressure that is there in university. That one is something that is there. The financial stress, majority of the students, when now you become a student leader and people are coming to you for help, you understand that these students are having financial stress and they don't know how to cope with these things. So as much as we also try to create awareness on these issues, we also have to look at the mental health of these students. This is something that is correlated. Drug and substance abuse is correlated with mental health. And as the previous speaker had said, we see majority of these cases in psychiatry. Mtu anakuwa heartbroken, depression, bangi leads to psychosis. So it is like a web, and we have to understand where it starts and we curb it from the start. In addition to having, you see, in medicine, we have preventive medicine, and then we have pharmacological and supportive. Supportive, it has already occurred. Now this has already occurred. This problem has already occurred. 75% of students are currently using drugs, be it alcohol, cat, mira, or bangi. So we have to understand, we have to come up with ways, as much as we have ways of preventing, we also have to come up with ways of supporting these students. And I think we can maybe increase the number of rehabilitation centers in the country, because at the moment it is not enough. That's for a fact. So if we also work towards that, as much as we are curbing, let us also support the ones who are already there. We ensure that they get the help they need. And we also, like as the previous speaker said, we destigmatize these issues so that they are able to come and seek help. When we understand that it is a link, we can curb it from the start. In addition to that, currently in my university, from January, we have had a lot of cases of indiscipline due to drugs. We have had related last day we're going to be having a drug and substance awareness walk. So if you might
Asante sana, Madam President. Okay, our next speaker ni the monk, Governor Chiromo Campus. UN Chiromo Campus. Karibu sana, Governor.
There's a hand that is up.
Governor
Hello, can I proceed?
Yes.
Okay. Thank you so much, the MC. My hand has been up for so long, but thank you so much for the opportunity. Good evening once again to our super PS. Mine is Odhiambo Lavan, a student leader, Maseno University. And I take this opportunity to appreciate you so much for taking your time to engage the youths. These are
Oh no.
Oh, sorry. I don't know what is happening on my side. Sorry. As I was saying, when we say no to drugs, every drug taken today steals the future of tomorrow. And as a nation, saying no to drugs is not just a personal choice. It's a public priority. It's just a public health priority. And drugs as a public threat is a burden to the family and to the nation as a whole. And those who suffers most are now the youths, the vulnerable communities. And it has a number of causes. Of course, we can say, like for me, those of us in Maseno, the comrades in Maseno, drugs like the alcohol and some that I won't mention, it is readily available to the youths and to the comrades, the community around. It is very cheap and readily available. This one accelerates the rate at which people use them. And due to the pressure of life and the lifestyle of the comrades, we understand that life do press to some extent. Some of us may feel lured to that direction. I'll really just give a little insight. That's only 3 things that I feel can help us elevate the challenge. One, just to agree with my previous presenter, to say that we can expand the mental health and rehabilitation centers. Some parts does not exist, so at least if we expand it, we are going to achieve a target. We can also integrate the drug abuse preventions into the primary level, back to the community. And again, we can strengthen the preventive education in schools. I'm very happy and impressed to hear you say that you will be paying visits to these institutions. And now it is not all about paying visits. Before you come, at least the message should reach the comrades. They are our targeted audience. For us, as the leaders, we have the task to spread the gospel to the comrades, just to prepare the ground. We can act like John the Baptist. And then lastly, the collaboration between the Ministry of Health, NACADA, the counties, the civil societies, the comrades. In fact, I'm very happy. Getting direct to the comrades is like getting to the whole country, because one comrade is linked to the community. It links to the parents who is also using a drug. The knowledge through the comrades is reaching home. These comrades interact with so many people. We are the majority in all this online platform. By one coming to TikTok talking about the side effect of the drugs and the drug substance abuse, all these things, once we are educated about this, we can be in a position to help elevate the problem. Once again, thank you so much. I'm very much impressed and ready to listen from my fellow leaders. And again, I say welcome to the varsity at the Equator, Maseno University, the fountain of excellence. Thank you so much for this program. And may God bless you. I'm looking forward to meeting you in a few weeks, as you said, to share with you the experience about mental health situation. Thank you so much.
Asante sana Odhiambo. Okay, Monko alikuwa anataka kusema kitu. Governor, I think you can hear sasa.
Because of time, kindly let us allow Collins Kipkemboi. Collins.
Okay, thank you for this opportunity. My name is Collins Kipkemboi. I was the president, former student leader at Kenya Medical Training College, Manza campus. So basically, thank you, Madam PS, for organizing this session. It is really a good one. But when I listen to drug and substance abuse, something to do with mental health, it's something which I've experienced upon it. Like, for example, during my experience in student leadership, we had a case which prolonged use of drugs and substance abuse led to mental health. Kuna mtu alikuwa ametumia bangi sana, then during siku moja akaenda akashika mtoto, then the villagers were like, huyu mtu anaiba mtoto wetu. So alichangamkiwa na watu, and when I really came back to him, he really wanted to go through rehabilitation, like alikuwa akitaka usaidizi, but now akukwa na we really have a problem with, like, maybe kama mtu anataka kurudi back, or maybe somebody wants to go to rehabilitated. Currently in Kenya unaenda psychiatry, but I came with this idea that maybe if we can come up with an AI solution, like a website yenye mtu anaweza kuwa anaingia hapo, anapata counselors, he gets his own rehabilitation, and also he can continue with his duties. So I really request Madam PS for you to adopt the project such that most of our comrades in our learning institutions can be able to access rehabilitation services even if they are continuing with their education, because unapata mtu akitaka kujirehabilitate, for example, na mtu ni student, so a comrade will see that hawezi akaambia mzazi, because most of us or most of the comrades wanakujanga huku college ndo wanaingia kwa drugs and substance abuse and those. So for somebody who really is in drugs and substance, to tell his parents that, niliingia huku nataka kujirehabilitate, take me to rehabilitation center, inakuwa ngumu kidogo. So
Yeah.
that's what I heard, and I think we can work together to advance this small idea I had in. And lastly, I'm finishing my course in radiography and imaging. So, Madam PS, ukisikia and
Niko hapa.
currently
We will work
utanipanga.
with you, Collins.
Aya,
We
asante.
will work with you. Mi nataka tu watu wamalize shule. We work together. Tumemaliza responses.
Madam PS, before we close,
Yes,
the
Martin.
incoming president, Multimedia University, wanted to speak. Jared Hillary, I don't know if is around. Jared.
Somebody I work with in the ministry. Hey, are you there?
Yes, Madam PS, I'm here. Thank you.
Please, Goteama comrades.
Comrades, habari zenu. It's a privilege and an honor to really join you peers for this great engagement with our colleagues and current leaders and future leaders. Actually, Madam PS, this is a very, very great initiative since when you look at the report that NACADA produced around 2 years ago, yes, the issues of substance use disorders, mental health issues, depression, anxiety are a very big concern actually within the universities and colleges. So as pointed out by the leaders, truly, Madam PS, we are taking notes from this side, from your office. And this is a conversation that we really want to appreciate that it needs to be taken to the next level. This is one of its own kind. It has never happened. And thank you, Madam PS, for this platform. Back to you, Madam PS.
Yes, PS unmute PS.
Hear me now?
Okay,
You can hear me now?
Yes.
Yes.
Great. I can see Adiele Onyenza. Mepotea. Onyeza? Okay, go on. Just go on with Kevin Odhiambo.
Okay, I see Kevin Odhiambo. Kiongozi.
Kevin Odhiambo?
Odhiambo, kindly
Good evening, everyone. I'm Kevin. Yeah, chair of the Thika Technical. It's nice to have such a platform with PS. The committee, allow me give you your flowers. You've done a good job. So mine is brief. I think this meeting form a basis for a well partnership that will last between the Ministry of Health and the youth, so that to ensure that we reach not only the maybe those who are in tertiary institutions, even those who are in institutions. So again, besides that, consider, I think the chair that is associate, she coordination, and he deserves maybe after this maybe tumpe hata credit for the good job. Otherwise
Angaliwe. Huyo chair angaliwe, si ndio? Okay.
Can I speak now? Can I? Yeah?
Yes, yes. I want us to welcome the somebody working with World Health Organization, Adiele Onyeze. Is a former acting Kenya representative. And I think this is part of the stakeholder that you people have requested for. So Adiele, please talk to the comrades.
Thank you very much, PS. Good evening, dear participants. Once again, yes, my name is Dr. Adiele Onyeze. Let me say I'm the outgoing head of the WHO country office in Kenya. And actually, I want to really commend PS Mary Muthoni and of course the Ministry of Health for this excellent work on this initiative to address drug and substance abuse. As we know, it's a big issue of concern, not just in Kenya, but actually across the African region and also the world. So we are very glad with this initiative, PS, and WHO remains dedicated to this effort. Let me say to all the participants, let us all work together to address this major health, not just a health, but also a socioeconomic challenge for the country as we all work towards a Kenya that is free of drug and substance abuse. Thank you.
Thank you. Thank you so much, Onyeze. So back to you. Back to you, Byron. We are already we keep with the comments that have already been made. So that we are able to Caparo. So that we are able to follow up on the same. This is not a health forum alone. I have seen people from engineering asking, na sisi J. Sisi wote, whether you are in engineering or teaching or nursing, hii platform ni yetu. This movement is ours and we have to own it. And once we own it, then we will be able to impact. Never start on something that has no impact, sustainability and visibility of it. So
kuna tashwishi kidogo. Super PS, unaweza nisikia?
I want to agree with all of you, hii kitu iko na shida, hatutarudia tena.
Yeah, this app.
Nimekosa sana.
This site, comrades,
Yeah. We will not use.
Yes, unmute, please. Unmute. Yes, we don't hear you.
Yeah, you're muted.
Yeah, the IT gurus get us the most favorable. So I was saying we have a way forward. We will make the minutes. We will ensure that we have, in the next 2 or 3 weeks, that we already have a meeting with the leaders. Byron, I know you have the names and the contacts of the leadership. In Akamvua, we just need to close this meeting so that we plan for the next meeting. But I'll hand it over to Byron so that he can close it up. And if there is somebody with a burning issue, please follow me on my social media pages. You can
Okay. So let me say, PS, are you?
Moshai, there was a Karatina University president who spoke already. Moshai Joseph, Karatina University president, already spoke. Byron, are you there?
Yes, I am.
Yeah, go ahead.
Okay, so to I was saying to our comrades, asanteni sana kwa kujoin hii forum, and the way I told you, our PS is very focused kusaidia ma comrades, ndio maana tulitisha hii mambo ya meeting, at least tukuwe na meeting na comrades, na vile niliwaambia PS amefurahi sana na nyani. So the only thing is, I think we're going to plan next meeting vile PS amesema, and then we will let you know. So to the comrades who joined, asanteni sana. Next time, I think we're going to mobilize more members, ndio wa join. So mimi sina neno mingi. The only thing is, we'll keep talking next time. Hizo group zetu za WhatsApp, we can add more members as well. And to our KMTCs, pia tunawa reach out, tukuwe na ma groups, na our colleges as well, tunawa reach out, ndio at least mambo ikuwe sawa. So kwa sahi, sina maneno mingi. And PS, I think we can just summarize and then we close it.
Thank you very much. Unless if there is somebody with a burning question like Willis, his hand was up and then he just dropped it. Okay, James is asking for the group links. How do they get to find the group links? Maybe
James,
Byron, you can give your number. Yeah.
Those who don't have my number, I think I can give you my number, please. To those who don't have my number, maybe mmejoin na mna namba yangu. I will give you my number and then I send you the link, mjoin groups. So tulisema, PS alisema kila university wakuwe na group yao. So kwa wenye waja create, please make sure to create, ndio tuwaweze ku reach out vizuri. So I can give you my number, guys, to those who are here. Maybe if you don't have my number. So my number is 07.
Okay, sorry. Go on.
My number is 07 68 41 16 14. So I have only one number na ni ya Safaricom peke yake, sina namba ingine.
Andika.
So naweza rudia
Sema tena.
07 68 41 16 14. So that's my number. WhatsApp calls pia inaingia. So PS, I think we can summarize and then we call it a day.
Yes.
Asanteni
And
sana
then,
kwa comrades.
And I can see Elvis Olala and Kings. Their hands are up. Just very quickly, Elvis.
Yes, to a pet time. Elvis Olala in that Olala, then Kings. Yeah, hivyo hiyo order haraka. Let's start na Elvis Olala. Elvis Olala.
Okay, Willis.
My name is Willis Atieno Odhiambo, the former Technical Vocational Educational Training Institute president. That is the president of TVETs in Kenya, but I'm the former and the current student, part-time student at the University of Nairobi. I just want to take this opportunity in a humble way to thank you, Madam PS, for bringing such an initiative. And I would like, as we are going on with the initiative, I would like my fellow comrades to include other comrades from the colleges, because I've seen college students. Their number have been a few here, and I'm much concerned from that department because I've been there, apart from being in university right now. So I would like the organizing committee, which is the executive, to liaison with anyone. Even I liaison with you so that we can bring more comrades as we are going to create this awareness. Yeah, saying no to drugs. Thank you very much.
Okay. Thank you.
Okay.
Ladies and gentlemen, we have come to the end of this meeting. Watu wa JKUAT, tunawakumbuka, tunawafeel, and we really need you here. KMTC students, you're not left out. In fact, nyinyi ni watu wangu, because you are under the Ministry of Health. So thank you very much, good people. And
Madam PS, before you finish, maybe through the chairman can give us a closing remark of 1 or 2 words, then we can close.
Before the chairman gives the closing remarks, Madam PS.
Yes.
I'm Johnson Moguso from Oginga Odinga University.
Yes.
Actually nimeingia late. Nilikuwa na another meeting, nilikuwa nimeattend but nilipata notification ni baadaye, just late. I'm representing the Jaramogi Oginga Odinga students. I think so. My network is
Thank you very much. We will give you some time to give us your speech next time. Because of time, we have had people online for 1 hour now, and I think it is time that we closed the meeting. Thank you very much. Have yourself a beautiful, beautiful weekend and a very good night. Bye.
Okay. Thanks, Super
Thank
for
you.
creating your time. Thanks, Papias, for creating your time for us. Appreciate.
We're meeting
Today
in 2
being-
weeks. Sorry. Oh,
poa.
someone is